Nursing management and delegation. What is delegation? Delegation is the process of assigning an additional task to be performed by one person while the other still maintains the accountability of the specific task's outcome. Unlike assignment, which are routine duties designated to a specific personnel's scope of practice, delegation tasks are given from a registered nurse to an unlicensed personnel, or UAP. As a registered nurse, we cannot just hand out any task to another person. Critical thinking must be used in assessing if the task itself can be delegated, if a UAP understands the task given, knows how to complete the task, and lastly, does the patient's needs match the UAP's capability? A nurse must ensure the UAP accepts the given task. Along with assessment, effective communication is needed for the specific task to be carried out safely. Monitoring the task completed, providing feedback is also needed. Ultimately, the desired outcome to the activity or task is the responsibility of both the UAP and RN, but the accountability remains with the licensed personnel. Delegation communication is a skill that takes both team members. Nurses who can effectively explain performance strengths and weaknesses and communicate clear guidance to requested tasks improve patient outcomes such as decreased falls and improve patient satisfaction. The 5 of delegation are a list of guidance set forth by the National Council of State Boards of Nursing to assist the decisions of delegation. They are the right task, that is, does this fall in line with the scope of practice for the UAP and the policy set by the facility? The right circumstance, the patient's conditions or needs match the competency of the UAP. The patient must be stable. Right person, does the UAP have the required training or education needed to effectively complete the task? The licensed nurse is accountable for ensuring the task is given and are appropriate. Right direction and communication. The communication and delegation must be a two-way system. That is, the nurse must effectively communicate the appropriate tasks to the support staff. The support staff acknowledge the request and communicate the acceptance of each task. The right supervision and evaluation. The nurse must monitor, evaluate, and follow up on the delegated tasks. Barriers to delegation include underdelegation, which occur when a nurse may be a perfectionist and may or may not believe in the task could be conducted properly by a UAP. However, using valuable time to complete a task that a team member could accomplish takes time away from tasks that can only be conducted by the nurse. Underdelegation impacts team milieu, patient outcome, and productivity in a negative manner. Instead, use some time to monitor the UAP completing the skills, giving guidance if or when it is needed. Overdelegation occurs when the nurse burdens the UAP with too many tasks. This is due to poor time management or lack of confidence in their own skills. Giving uneven weighted workload leads to poor work environment, reduction in productivity, burnout, and a decrease in patient outcome. Instead, communicate effectively the needs to the support staff and assess the proper workload to be given, while remaining receptive to feedback. Improper delegation occurs when a nurse delegates a task to a UAP that is outside the scope of position. competency, or understanding. This can lead to serious consequences that the nurse and facility will be open to litigation. Instead, use the 5 rights of delegation, communicate with the UAP about the task, and assess the capability of completing the task safely and correctly. Virginia state guidance states registered nurses who are delegating tasks to a UAP must thoroughly assess the appropriateness of the delegated task, have a clear understanding of the patient's conditions, as well as the skill level required to safely and effectively complete a task. Provide supervision to the UAP completing the task, and promptly provide education and feedback on their performance. Thank you.